Good afternoon. It's 1 o'clock, so we'll get started on our webinar. Thank you for joining us. The intent of the next couple hours that we spend with each other is to really understand the new leave rules that came out from the federal government in the Coronavirus Act, and these are to support families and employees. So they changed as of Sunday, April 5th, and I have great staff here that are going to walk you through so you can understand the impact of that. So we'll give you go back one there. We'll give you an overview of this act and understand there's two categories of leave, one emergency paid leave and one emergency family medical leave. And then what is different about the leave requests and the process that you're going to use moving forward. These things happen under great partnerships. So from finance and budget and the payroll department, Jesse Soto and Juan Cadora have been wonderful partners as Lindsay, Nick, Sandy, and myself have worked to bring this forward. So I want to thank my team. They've done really, really phenomenal work, and I know that you all appreciate it as well. Before I hand this off to staff, I want to talk about kind of 4 overreaching kinds of goals of this time that we're going to spend together today. And that's that we want to be able to administer these leave requirements with what I call the 4 C's. We want to give you information so you can be correct and accurate in how you manage that. We want to give you information that is going to allow you to be consistent, that people will be treated fairly and equitably through these new regulations. We want to remind you of how confidential this is. These are people's medical information and it's protected by law. So please make sure that we work confidentially and it's a part of the overall package. And most importantly, I think, is being compassionate. This is a time where all of us are incredibly stressed. There's lots of unknowns in our world. And as we work with people who are trying to manage their family and their finances and their health, that we do this with a strong sense of compassion as we move forward. So let's ask you to remember those 4 C's as we give you all the requirements of the new leave regulations. Lindsay, I'm going to pass it on to you.
Great, thanks, Joanne. So as we get started today, I want to go over through just a couple housekeeping items that we need to cover. Just a reminder for all of you, today's session is being recorded. We did a webinar exactly the same as this last week that is already posted and recorded, but we will also be recording today's session as well. A copy of the presentation, the slide deck, the video recording, updated FAQs, and our forms are on the HC&D intranet site. So everything there is available for you. Also, if you have any questions today, please reserve them till the end. I'm going to answer all the questions at the end, and sometimes you might be submitting questions that I will be answering. So just be mindful of the questions that you're submitting. You can submit them in the chat as we are meeting today, or you can send an email to covidleave@metro.net. My staff and I are actively monitoring that inbox, and so if you have any questions after today's presentation, we welcome you to submit questions there. Additionally, I wanted to let you all know, you might have seen in the appointment announcement that we are doing some brown bag Q&A sessions this week. Wednesday, Thursday, and Friday of this week. And that will be me along with Jesse and Juan from payroll and accounting to basically give people an opportunity to ask any kind of questions that you might have. It's kind of like a live office hours for everyone. So if after today, you've had some time to digest the material, if you have additional questions, feel free to register for one of those brown bag sessions, and we can talk live. So with that said, we'll jump into the meat of today's presentation, which is the Families First Coronavirus Response Act. We're going to be referring to that law today very frequently. We'll be referring to it as the FFCRA going forward. So what is the FFCRA? This law has 2 components to it, essentially. One is an emergency paid sick leave component, and we'll refer to that as EPSL today. And then there's also an emergency family medical leave component that we will refer to as EFML. So a little background about the law. Obviously, this was passed in response to the current coronavirus pandemic that we have, and trying to give employers some tools to help employees who are in need of leave during this time. The law was made effective on April 1st, and it runs through the end of this year, December 31st. The law applies to all government agencies and to certain private sector employers. Worth noting that this law is not retroactive, meaning that you all know that we were operating kind of under a different leave request process prior to this past Sunday. That was just a Metro designed process to try to support employees in what ended up being a very, fluid and sudden situation that we were trying to deal with. But Metro provided those leaves, and that doesn't apply to the FFCRA. So anything that we did prior to the enactment of the FFCRA doesn't quote unquote count for purposes of the FFCRA. So this slide really should have been updated from the last presentation, but what our current leave process is now the FFCRA process, but our prior leave process didn't align with the FFCRA, not because it was somehow illegal or we were doing anything wrong. It just was doing different things than the law requires us to do. So the process that we're going to discuss today actually replaced that prior process. There are no more COV and SAH pay codes available as of the start of this pay period, which was last Sunday. So if you try to enter in those pay codes for this pay period that we're currently in, you will not be able to do that. So if you have any COV or SAH agreements that are still out there that haven't been re-reviewed and re-approved under this new FFCRA process, you definitely need to take a look at that and make sure you touch base with those employees to better understand what their needs are. So this is just an overview of kind of what the FFCRA is, what it provides. We've got that EPSL side. Generally, it's about up to 80 hours paid leave provided by Metro. There's multiple qualifying reasons that someone can receive this leave. And depending on the reason, they'll either receive full pay or 2/3 pay, and that's subject to various caps that we'll cover in more detail. We also have the EFML side. This is a 12-week leave entitlement that runs against your regular FML. So the difference here is that it's specifically for childcare purposes. This is an expansion to the current FMLA. Weeks 1 to 2 of this leave are unpaid, and then subsequent weeks are subject to 2/3 pay, again, with various limits that apply, and we'll get into those in more detail. So let's first look at EPSL, Emergency Paid Sick Leave. As I just stated, this generally provides employees with up to 80 hours of leave, which is paid by Metro. There's multiple reasons that we'll go into detail with each one. And depending on the reason, the employee will receive full pay or 2/3 of their pay, subject to various daily and total caps. All employees are eligible on day 1 of employment, and this includes all contingent workers. So temporary employees, intermittent employees, your ELT, transportation associates, your admin interns, everybody. And really the threshold inquiry for this type of leave is that the employee has to be unable to work or telework. So the employee can't say, well, I don't want to telework, so I want this leave. That's not how this leave works. The employee would truly have to be unable to work or telework because of one of the qualifying reasons that we'll go into more detail about here in a moment. And just a reminder, whether an employee is able to telework is ultimately a decision that management needs to make, and it's going to be based on the nature of the employee's work. We obviously have some employees who simply cannot telecommute. A bus operator cannot telecommute, whereas admin staff, administrative staff, there's a lot more flexibility there. So just a reminder of that. So I'm going to quickly run through what all of the different qualifying reasons are before we jump into each one in detail. So number 1, an employee can receive this leave where they are unable to work or telework because they are subject to a federal, state, or local quarantine or isolation order related to COVID-19. They've been advised by their healthcare provider to self-quarantine due to concerns related to COVID-19, or they're experiencing symptoms of COVID-19 and they're seeking a medical diagnosis. Additionally, the employee could be caring for an individual who is subject to a quarantine order related to COVID-19. They could be caring for an individual who has been advised by their healthcare provider to self-quarantine due to COVID-19 concerns, or they're caring for their child because this child's school or place of care has been closed. Another child care reason is that employees could be caring for their child because their child care provider is unavailable due to COVID-19 precautions. And then finally, we have this number 8 kind of catch-all, experiencing, where the employee is experiencing any other substantially similar condition as specified by the Secretary of Health and Human Services in consultation with Treasury and Labor Departments. So let's break down each one in detail. Number 1, employee is unable to work or telework because they're subject to federal, state, or local quarantine or isolation order related to COVID-19. So this reason really applies to the various stay-at-home orders and ordered business closures that we're seeing across the country. As you know, LA County is under an order, the state of California is under an order, but Metro is actually exempt from those orders, and that's due to the nature of the service that we provide. We provide a public service. So we're technically exempt from that order. That's why we have our workers reporting to work. And so the intent of this reason is really that the order has to cause you to be unable to work or telework, even though the employer has work that you could perform, but for the order. So in other words, if not for the order, I would be able to come to work and do my job. But because the order is in place, I'm unable to do so. So I don't know that this will be a very common reason that we'll see at Metro, again, due to the fact that we're exempt from that order. But, we have to look at these cases on a case-by-case basis. For employees who do happen to qualify for this reason does pay at their regular rate of pay, so 100%, but up to a $511 per day cap and $5,110 in total. Qualifying reason number 2, where the employee is unable to work or telework because they have been advised by their healthcare provider to self-quarantine due to concerns related to COVID-19. So this type of leave can run concurrent with an employee's regular FML because it just depends on why they're out. Some employees come to us and say, I need leave for self-quarantine because I'm 65. That is not in and of itself a qualifying reason. Okay, we need something more. What we need is the healthcare provider portion. The healthcare provider actually has to advise the quarantine. Okay, so again, just having an underlying condition or just being of a certain age isn't alone a qualifier under this reason. Got to have something additional, and that's the healthcare provider's advisement. Okay. Now, some employees, again, it might be where regular FML also applies to this leave and some not. It will just depend on the reason that they've been self-quarantined, and the employee can share that. We have heard that we should request medical documentation to support, but I caution here, and we've updated the forms to better reflect what documentation we really can request from employees, because, again, this has been a very fluid situation. As the law evolves and we get further guidance from the Department of Labor, we will update our materials accordingly. So one thing I just want to note here is that we should be careful, managers and supervisors, when you're requesting any kind of documentation from employees. The law says that we really just need the name of the healthcare provider who's made the advisement, and you will see that reflected on our new forms. And this type of leave also pays at a regular rate of pay, that 100% pay rate, up to the $511 per day cap and $5,110 total cap. Qualifying reason number 3, where the employee is unable to work or telework because they are experiencing symptoms of COVID-19 and are seeking a medical diagnosis. Unfortunately, we have had some positive cases at Metro, and so you will see this as a valid reason. The key there is that the employee has to be seeking a medical diagnosis. So, just because an employee is having flu-like symptoms, and that alone isn't enough under this reason either. They would need to actually be seeking a medical diagnosis. And here, the law does not say that we just need the name of the healthcare provider. It is actually silent on this point. And so my recommendation is that we should get medical documentation to support this type of leave. it's also important just because of general health and safety reasons. There is a reporting process that's put in place by corporate safety that all employees need to follow if they suspect they've been exposed to the virus. So I think requesting medical documentation here would be appropriate. And again, this is one of those reasons that entitles an employee to full pay up to those daily caps that I've discussed before. Looking at qualifying reasons 4 and 5, these are grouped together because they're quite similar. We have where the employee is unable to work or telework because they're caring for an individual who is subject to a federal, state, or local quarantine or isolation order related to COVID-19, or where the employee is unable to work or telework because they are caring for an individual who has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. So you see how these two kind of mirror the two reasons we just discussed, where you see reasons 1, 2, and 3 are really related to the employee and themselves caring for their own condition. Here we see where employees are caring for someone else, not themselves. So that's a good way to look at the two distinctions. And you can see that reflected in the pay, because here we have a pay rate of 2/3 per day, up to $200 per day and $2,000 in total. So again, that's a 2/3 pay rate, 2/3 of your regular rate of pay is what you're entitled to under this qualifying reason. Something I wanted to point out here that's important as well, because you may see this in requests, the law very specifically uses the word individual. So that means that it's not necessarily a family member that the person might be caring for. So, very commonly we see FML requests from employees who are caring for their spouse or their mother or whoever. And because under the FMLA, there's that family relationship that's required. Here you don't see that. We just see individual. But the Department of Labor has also provided us guidance that says, there can't just be no relationship there. There has to be some kind of reasonable, legitimate reason for the person to be caring for this other person. So I can't just decide I'm going to go care for my neighbor down the street who I don't know. There has to be some connection there, some relationship. The question is, what kind of document can really be provided by the employee to support that? It's going to depend. We, again, have to look at these cases on a case-by-case basis and use common sense and be reasonable when you're looking at what kind of documentation to request. Qualifying reasons 6 and 7, again, these are kind of grouped together due to the type of reason they are, and it's really childcare. We have where the employee is unable to work or telework because they're caring for their child because the school or place of care of the child has been closed, or where the employee is unable to work or telework because they are caring for their child because the child care provider is unavailable due to COVID-19 precautions. So that could be where my child's school is closed. Maybe their daycare provider is closed. I know that many schools have said maybe a May 1st opening, but that could be extended to the summer. Maybe some schools are not going to open again before the summer. So this could carry into the summer where we see employees who say, well, I normally would leave my child at the YMCA. That's what I use for childcare during the summer when school's closed. But now the YMCA is closed. That would qualify under reason number 6. Now, reason number 7, where you see the child care provider is unavailable, I think where this one commonly comes up is where you have like a nanny or a family member who cares for your child, and that person has to quarantine. So they're unavailable due to their own having to take precautions, or God forbid they actually are a confirmed case. That's where you might see that reason coming up. I wanted to also talk about what is a child, because under our prior leave scheme, we had kind of made a delineation between children under the age of 14. So we said your child had to be 13 or younger. Here, the definition of a child aligns with the definition of a child under the FMLA, which is a son or daughter under the age of 18. That could be a stepchild, it could be a foster child, or it could be someone with whom you're standing in loco parentis. And that means basically somebody who you essentially care for, even if there isn't technically a blood relationship there. A good example of that would be maybe you have a live-in boyfriend or girlfriend, and you guys have lived together for 5 years. Your significant other has a child, not your biological child, but for the last 5 years, you've essentially raised that child. That could qualify as an in loco parentis relationship. I also want to note that this also includes children who are over the age of 18 who are, due to a disability, unable to care for themselves. So maybe I have a child who is 30 years old, but they suffer from some sort of disability that prevents them from caring for themselves at all. That is also a person that would be considered a child under this law. So we can request some documentation to support the need for leave for one of these reasons. But really what we want is just essentially the children, who are the kids, and what is the name of the school. That's really what we're looking for. Right now, we know that schools are closed. So I don't think it seems reasonable to be requesting necessarily documentation from the school. But that might become reasonable as schools start opening again and not everyone is following the same kind of directions with this stuff. So again, I just urge you to be reasonable and use your common sense when you're requesting documentation. Now, we'll get into this more in the next section, but this type of EPSL might run concurrent with an employee's emergency family medical leave, their EFML. So we'll get into that later. But similar to the last reasons that we covered, this reason for leave also pays at the 2/3 rate up to $200 a day and $2,000 in total. So finally, qualifying reason number 8, this weird one about the Secretary of Health and Human Services. It's very legalese. And that's because right now, there's really no use for this reason. We should not see employees using this at all because Health and Human Services has not yet identified any substantially similar condition. So there's no way we can even use this as a reason, but we have to include it because it is a part of the law. What this will look like when it's used, I don't know, but as we receive more guidance from the Department of Labor, we will absolutely make sure our materials are updated and that you're provided with some guidance on how this could potentially be used in the future. So documentation, I've kind of talked about this throughout each reason because documentation, depending on what the reason is, it'll vary what is really required. And I keep using that word reasonable because I want you to be reasonable when you're thinking about the documentation that you need. The new FFCRA leave forms that we've developed specify for each reason what kind of documentation we're really seeking. Beyond that, you really don't need to ask for anything. If you have questions, if you're not sure what to do, if the documentation you do receive is not clear, please let me know and I can help walk you through that. Additionally, just as a note, we discussed some forms of that EPSL leave might run concurrent with an employee's FML. And I'm not talking about EFML yet, just the regular FML. So for example, if I have COVID, that could perhaps run concurrent with my FML. Or if I'm caring for my mother who has COVID, that could run concurrent with my FML. I would need to provide the regular documentation that I would provide as required under the FMLA. Okay, so generally that's like a medical certification from your doctor. So how much leave do you get? What is the duration of this leave? I mentioned that full-time employees are going to get up to 80 hours. Part-time employees, the number of hours that they get depends on the number of hours that an employee works on average over a 2-week period. So we look back 2 weeks and say, what's the average number of hours worked? That's how much leave a part-timer will get. We use the same calculation for employees who are operating on a varied schedule. So maybe 1 week they work 30 hours and 1 week they work 50 hours. We use that same 2-week average. These types of leaves can be used for partial day absences, and they can be used intermittently. But I want to note really for the reasons 1 through 3, when you're taking leave for yourself, those types of leaves really can't be used for partial day absences or used intermittently. When you look at what is the leave really for, that leave is to either be quarantined or because you're actually confirmed to have COVID or you're seeking a COVID diagnosis. These are not folks that should be coming in and out of the office and working intermittently. So just common sense says those types of leaves really can't be taken intermittently due to the type of reason you're talking about. But when you're talking about caring for someone else or childcare, certainly those types of, that type of leave could be, where I come in a couple days a week and then I'm off a couple days to care for my children, just depending on what my needs are. Additionally, I wanted to note you can use EPSL for multiple qualifying reasons. So if I need to take leave for childcare, but I also need to take leave because my husband has been quarantined and I need to care for him, I can take both of those, but only up to 80 hours total. So I can't get 80 hours for each qualifying reason. It's 80 hours for all qualifying reasons. So how does overtime factor into this? Does it? The answer is yes, it does. We have to factor in overtime, but you're still capped at 80 hours over a 2-week period. So what does that really mean? An example we have here is Jane, who's scheduled to work 50 hours a week, can take 50 hours of paid sick leave in the first week, and then she can take the 30 hours of paid leave in the second week. So you see, it didn't end up being a 40-40 split because she normally works 50 hours. We paid her 50 hours in the first week, and then she will get the balance in that week too. Either way, she's capped at 80 hours. So we talked a little bit about pay as well as we were going through the different reasons. And again, when you're taking leave for yourself, generally speaking, that leave is paid at 100% up to certain caps. When you're taking leave to care for others, including childcare, that's where the 2/3 pay comes in. So employees ask, well, what can I do to make up the difference? And employees can elect to integrate their accrued paid leaves with their EPSL payments. So for those of you who in the past may have taken SDI, it looks similar to that, where you'll charge a portion of time to EPSL and then use the balance out of your own accrued paid leaves. An employee can also decide, I'm just going to take EPSL. I'm not going to supplement it with my paid leave, and that's fine. An employee can also say, I don't want to take EPSL. I would just like to take my own leave, and you are able to do that. Each of these are up to
Lindsay, we can't hear you.
Than the daily cap of $511 a day. Those employees cannot integrate their paid leave to quote unquote make them whole, but instead they can elect to just take accrued leave in lieu of EPSL. So they can say, instead of taking EPSL, I'd rather just take my own accrued paid leave. That way you'll get more money that way. What does the request and approval process look like? Very similar to our previous process. We reworked the forms. So instead of forms 1, 2, and 3, you'll now see forms A, B, and C. So the employee is going to complete form A, select the qualifying reason for leave. You have to enter in some additional information, and then your direct supervisor will either approve or deny the request. We're asking now that supervisors just maintain those forms in the employee's departmental file. We don't know yet if those will be something that we end up putting in an employee's central personnel record. So for now, just hold on to them. And I also want to emphasize confidentiality. It's very important that the confidentiality of these requests are maintained. So what does that mean? One thing that I've seen come up is that sometimes supervisors want to ask, well, what's your underlying medical condition? What's making you susceptible to the virus? We cannot ask that question. We're not entitled to that information. So don't ask employees what their underlying medical conditions are. Further, we want to just keep the request for leave confidential to the fullest extent that we can. Obviously, there's going to be some people that need to know. Maybe it's people who in your department are administering the leave. Obviously, people up your chain of command might need to know. Clearly, HR personnel are going to be involved. That's all fine, but you just want to make sure you're discreet and not sharing information unnecessarily. What that looks like with COVID cases, too, is important because, yes, there is a process that you must go through if someone in your department comes to you and says, I think I've been exposed, or I think I actually have the virus. You need to report that to corporate safety. They have a whole process that's outlined how that's supposed to be handled. What you should not do is start sharing around the department, hey, this person tested positive. and especially what that person's identity is. You know, Metro again has a very clear process on how to handle that process of reporting a positive or a potential exposure. And so we just want to be mindful of adhering to that. That process does take into account an employee's confidentiality. So for timekeeping, I'm going to turn this over to Juan and Jesse to talk about the specifics of how to code time for EPSL.
Thank you, Lindsay. So this is, I guess, a really important topic for everybody is how do I get this into our timekeeping system? So what we've done is we've created 2 new codes for EPSL, for the emergency paid sick leave, because there's 2 categories of EPSL. There's the first 3 categories and then the bottom 8. The first 3, which are the ones that pay at your regular rate, we've created a code EPQ. An EPQ will pay up to $511 a day or $5,110 in total. When using EPQ, for those first 3 reasons, as Lindsay was saying, you should put in the 8 hours because we don't expect that there's going to be, that you're going to be working part of that time. We expect that you're going to be in quarantine. So you would be coding 8 hours of EPQ. For the reasons 4 through 8, those reasons, as Lindsay mentioned, pay not at your regular rate, but they pay at 2/3 of your regular rate. And they also have some caps. The caps are $200 per day and $2,000 in total. For this portion of EPSL, we've created an earning code, EPC. Assuming that you are using your 8 hours of EPC on a particular day, you would code 5 hours and 20 minutes of EPC, and now you have the opportunity to integrate with some other leave to get you to your full 8 hours. So the 5 hours and 20 minutes would be EPC, and then you would have 2 hours and 40 minutes of paid time, TOV, sick time, vacation, etc. Lindsay did mention that EPC can be combined with EFML, which she's going to speak to in more detail next. If there is a combining of EPC with EFML, then you would code the EPC and the integration the same as you did up above, so 5 hours and 20 minutes and 2 hours and 40 minutes. But because it is related to FML and related to the EFML requirement that the first 2 weeks are unpaid, we need to be able to track the hours related to those first 2 weeks and the fact that they affect FML. So if you are using EPC to pay for part of those first 2 weeks of EFML, you would code EPC 5 hours, 20 minutes. You would integrate with some sort of paid time, 2 hours and 40 minutes. And then there's a new code, FMU, and that code is used to track those first 2 weeks that are unpaid. So you would code 8 hours to FMU and then 8 hours to FML, because those first 2 weeks that are unpaid, they still count towards the FML hours. And when you are recording all of this time, you want to make sure that you're using the correct project and tasks. New projects and tasks were created for purposes of these, let's call them benefits of this COVID or FFCRA. So there's one for bus, one for rail, and basically one for all other. They all start with 1019, and then it's 01, 01, 02, 01, 03, 01. Okay, Lindsay.
Great, thank you, Juan. So what happens when your 80 hours is up? What happens when your EPSL exhausts and you still need leave? At that point, the employee just needs to follow regular leave of absence procedures. So let's use an example of an employee who actually gets COVID. I'm a confirmed case. So what do? I need more than the 80 hours that's provided to me under EPSL. Well, I would just go to my manager, make the leave request, and then I would most likely apply for state disability insurance. Similarly, if I went off to care for someone else and I required more time, I could apply for paid family leave benefits. And these benefits are not Metro paid. These are administered by the California Employment Development Department, the EDD, and they're not COVID related necessarily. They've been in existence a while, but you can certainly use them, if qualified. So if you run into that situation, we will give you the information that you need to go apply with EDD for either one of those benefits. You can, as we discussed, integrate your paid leaves with either SDI or PFL in order to get you closer to whole as well. If you have no accrued paid leave, then you would just get the SDI or PFL benefit, or you would just simply go unpaid if you didn't qualify for either one of those forms of leave. Note that if you are approved for additional leave beyond the EPSL, that instance of absence is not chargeable. That means it would not subject you to any kind of discipline. It would be considered, an off with permission. And again, just a reminder that depending on the reason the person's off, you just remember to run the leave against their FML. If for childcare, it'll run against their EFML, which we'll talk about next. But namely, if you're off work to care for yourself due to a medical condition, or you're off to care for the medical condition of one of your family members, that is considered leave under the FMLA. So if that leave, that additional leave ends up extending past 30 days, what do you do? Well, it depends on why the employee is off work. If the employee is off for their own medical condition, you just need to pass them to DI. That's part of your normal leave of absence procedure. At that 30-day trigger, you move them from active status to P status, and the leave reason is DI. Then also attach Form A and their doctor's note and email that to COVID leave at metro.net with the path, and that goes to my team. Most of you are familiar with Liz Paz, Rosalind Chong, and Jenny Nguyen. They will be the ones managing this type of leave if it extends beyond 30 days and depending on the cost center. If the employee needs more than 30 days of leave to care for a family member or an individual, you can submit the path to FL. And again, it's the same procedure. Submit the completed Form A and any of the supporting documentation to COVID leave at metro.net and along with that path, and my team will manage the leave. If the employee has been on leave because of childcare or school closure, we're going to talk about what that EFML process looks like, but just note that that's a leave that's going to be managed by the employee's department. So they're going to manage the start and end of that leave, and just remembering that that's up to 12 weeks of leave. There is no pathing that's required for this. So again, just something that the department can monitor via the request forms. If an employee is on leave for any other reason, it's going to just depend on the particular case. Not everything always fits neatly into one of these buckets. And so, use your common sense. You might need to path the employee to DI or FL. You might not need to path them at all, but you certainly can reach out and ask. So if you have questions about a case, you're not sure what to do with an employee once their EPSL exhausts or at that 30-day mark, please reach out to COVID leave at metro.net or reach out to one of your short-term disability compliance representatives. We are happy to assist you. What does the return to work process look like? So for those folks who are on DI or FL, you just continue the standard practice. The leave's going to be managed by my team, as I shared, and so they will be the ones to coordinate the return to work physical and the clearance email. You guys are probably very familiar with what that looks like. For childcare and school closures, there's no return to work physical necessary. Remember, this is being monitored by the department. The forms B and C will indicate when the employee is supposed to return. So, depending on how many employees you have off on this type of leave, you probably want to have somebody in the department who's kind of tracking, where those folks are, just to ensure that they're, within their agreements. For any absence that's less than 30 days, you can just follow your collective bargaining agreement or Metro's attendance policy on what the requirements are. Most require a doctor's note after 3 days, but it depends on why the employee was off. Now, certainly if an employee was out because they were ordered to self-quarantine due to potential COVID exposure or because they themselves were confirmed to have COVID, those folks definitely need a doctor's release prior to return to work. And right now, the guidance I have received is that those employees will also be required to attend a return to work physical at Metro's clinic, but we are 99% going to do those return to work physicals virtually and not in person. So that's a positive for the employee to try to avoid having to send you to the clinic and potentially be exposed to cases there. It's a burden on the clinics. So I think that process will work well for employees who are going through this. But for your average employee who's simply been ordered to self-quarantine, maybe because of age or because of an underlying medical condition, those employees really don't need a return to work note because they weren't off for a particular condition. So just look at things on a case-by-case basis. And again, kind of use your common sense based on what your experience is. Okay, so moving on, we'll talk about emergency family medical leave next, or EFML. So as I've shared, this EFML is really an expansion to our current FMLA, the Family Medical Leave Act, and it provides additional job-protected leave for childcare purposes only. Now, when I say additional, meaning this is an additional qualifying reason to get FML. It can run concurrent with EPSL, so if I'm taking childcare leave, that obviously there's a pay component under EPSL, so this EFML would run concurrent with that. And who's eligible? This is different than under the regular FMLA. Any employee who has been employed at Metro for at least 30 calendar days is eligible to receive FMLA. So that's different, EFML. That's different than the FMLA, which has a 1,250 hours worked and 1 year of employment requirement. We don't have that here. So don't get the two confused. If the employee has been with us for 30 days, they are eligible to receive EFMLA. So what are the qualifying reasons for EFMLA?
Lindsay, your mic.
Did it go out?
Yeah, it cut out for like 20 seconds.
Oh, okay. Do you know where there was a gap? Should I go back?
FML, sorry. Go back to the last slide.
Here? I'll cover this slide again for good measure.
Okay.
So this might be repetitive, but the EFML is an expansion to the current Family Medical Leave Act that's in place, and it provides additional job protective leave for childcare purposes only. I say additional leave, I don't mean on top of the 12 weeks, I mean an additional qualifying reason for FML. This can run concurrent with EPSL. Again, EPSL provides pay for 80 hours of leave due to childcare needs, so this EFML can run concurrent with that. And who is eligible? This is different than under the FMLA, so this is important to note because most of you are probably familiar with the 1,250 hour requirement. You have to work 1,250 hours and you had to have been employed with Metro for at least a year prior to the date of your request in order to qualify. That is not the case here, so don't get those two things confused. The only inquiry you need to make here is, has the employee been employed with Metro for at least 30 calendar days? The answer is yes, then they're eligible to receive EFML. Assuming, of course, they have FML available. We'll get into that in a moment. So what are the qualifying reasons for leave? This is limited, again, only to childcare reasons. So where an employee is unable to work or telework, and again, because remember, the need for childcare has to prevent the employee from being able to work or telework. So the employee is unable to work or telework due to a need to care for their child because the child's school or place of care has been closed, or because their child's childcare provider is unavailable due to a public health emergency related to COVID-19 as declared by a federal, state, or local authority. So very similar to those reasons you see under EPSL. Once again, the definition of a child aligns with that under the FMLA. I won't go through all of that again, but just as a reminder, it's a son or daughter under the age of 18, and that can be a stepchild, a foster child, or someone with whom you're standing in loco parentis. It can also be an adult who is too disabled to care for themselves. So if you have an adult child and you have to care for that child because of a physical disability that they have, that would also be considered a child for purposes of this law. So what is the leave duration? I mentioned it's 12 weeks, that's 480 hours. This is not a separate leave entitlement from your regular FML. So it runs against your FML balance. So how much you're entitled to use is going to depend on what your FML usage has been within the 12-month period prior to the date of your request. So for example, if within the last year, I used all 480 hours because I was out due to pregnancy, I would not have any EFML available to take for this purpose. The leave can be taken intermittently or on a reduced or part-time schedule, just like with regular FML. What do you do when both spouses work at Metro? We have a lot of these cases, and as I mentioned before, the law is still evolving and it's a little bit unclear at this time what to do. But if we look at what we do under the regular FMLA, baby bonding time under the regular FMLA is shared between the two spouses. So that means they split the 12 weeks. Each gets 6 weeks. If we analogize that to this type of childcare leave, then that would be the case here. So that's generally what my guidance is. I would require spouses to split that 12 weeks because I think that most aligns with the FMLA. But stay tuned because things can change as we receive additional guidance from the Department of Labor. Another huge difference between EFML and the regular FML under the FMLA is that there's a paid component to this EFML. So we talked about how there's 12 total weeks, the first 2 weeks of which are unpaid, okay? But you can substitute pay with using EPSL during that 2-week period. So the leave is running concurrent. You've got EPSL going that's paying you. You've got EFML going. It's not paying you for the first 2 weeks, but it's running concurrent. After the first 2 weeks, Pay by Metro will kick in at the 2/3 pay rate. So you'll see, where again, you're able to integrate your own paid leave if you want, or you could decide I'm going to substitute entirely my own accrued leave. I don't know why you would do that, but it's certainly an option for you. Again, there are caps here as well. We've got a maximum daily cap of $200 and then a $10,000 total cap. If we look at it in the aggregate, so all 12 weeks of payment would actually be $12,000 because you look at the first 2 weeks, $2,000 of EPSL, and then another $10,000 for weeks 3 and on under EFML. And as I mentioned, employees can integrate their accrued paid leaves. That integration does not apply to caps, by the way. That's separate from the cap. The cap only applies to the payment that's coming from Metro, that 2/3. What does the leave request and approval process look like? So as I mentioned before, we have the new forms A, B, and C. The employee is going to complete Form B. You will need to provide the name of the school that's closed or the child care provider who's unavailable. And you also need to provide the names of the children. We have here ages, but the law actually just says names. And that will be noted on the form, you'll see. You indicate what your needs are, what your leave needs are. If you have intermittent needs, you can note that as well. You're going to submit Form B to your direct supervisor, and then your direct supervisor will complete Form C. So again, this is very similar to the FML leave request process where you submit a request and then your manager is going to return you an approval or a denial. So it's important that the direct supervisor, you're mindful of what this process looks like because there's a couple things you need to do. One, you have to look at, is the employee even eligible? So threshold inquiry, has the employee been with Metro for at least 30 calendar days, yes or no? If they have been, do they have FML hours available? So you'll have to run those hours. If you've never done that for an employee, you can reach out to your short-term disability compliance rep or email loamedical@metro.net, or you can email covidleave@metro.net, and we will help walk you through that process. But you do need to find out, does my employee even have FML hours available? Based on what you learn from those two inquiries, you can either approve or deny the request. You could maybe also deny the request because they're submitting it for a reason that doesn't qualify. So I have seen where employees are trying to submit requests for EFML when they are taking leave because they're doing self-quarantine. That's not a qualifying reason for EFML, so just be mindful of that. When you approve or deny the request, you need a note on the form as well. How many hours does the employee have available? So the employee knows, this is what I have available to use. You'll see that indicated on the form. Obviously, make sure that the employee receives a copy of Form C for their own records. And then you can maintain a copy of the forms, again, in the employee's departmental file. So I'll turn it over to Juan for the timekeeping aspect.
Great, thank you. So with EFML, which is on Form B, as Lindsay mentioned, we also had to create 2 new codes. And the reason for that is because although EFML is 12 weeks, the first 2 weeks are unpaid. So you have to take 2 weeks unpaid as FML or EFML before you can actually start getting paid on weeks 3 through 12. In order to capture those first 2 weeks that are unpaid, we've come up with the code FMU. So during those 2 unpaid weeks, at a minimum, this is what you would need to record. You would need to record FMU for 8 hours per day, and then FML for 8 hours. Because even though it is unpaid, it does go against your FML balance. Now, as Lindsay mentioned, you can integrate during these 2 weeks with other types of leave. You can integrate with EPSL, and you can also integrate with other types of your own personal leave that you have. If you were going to do that, you would go back to page 27 where we showed what that would look like. The second code that we created is code FME, and that code is used for the hours of weeks 3 through 12. This code pays at 2/3 of your regular rate, again up to $200 per day and $2,000 in total. If you are taking 8 hours of FME, you would code it 5 hours and 20 minutes of FME, but now you get to integrate to get to 8 hours for the day. So you would code 2 hours and 40 minutes of FMV or FMT, assuming that you have vacation or sick time, etc. But you still have to record 8 hours of FML because altogether these go against the FML balance. And similar to the discussion on the previous page, you want to make sure that you post all of this timekeeping to the correct project and tasks.
Great,
Okay,
thanks. Thank you. So in this case, what happens if the employee doesn't have FML available, or if they've exhausted their FML, midway through the process? What do we do for those employees if they still have a need to take leave because of childcare? Once again, you're going to refer to your regular leave of absence procedures. Leave at that point will have to be paid through their accrued paid leaves. So if the employee doesn't have leave available, they would have to go unpaid. But once again, if an employee is approved for this kind of extension of leave, the instance would not be considered chargeable, so it would not subject them to discipline. The return to work process is, again, very simple. We kind of touched on this before. If the employee is out less than 30 days, they don't need a physical. They can just come back to work. If they're out for more than 30 days, there's not PAF required. Again, no physical necessary there. The department's going to be managing the leave based on what's indicated on Forms B and C for the employee. So that wraps it up for EFML. So I want to give you the opportunity to ask any questions you have about the materials we just covered. Juan and I are available now to answer those questions. Sandy can read them to us. But I want to encourage you after today, if you do have questions, there's some resources for you. You can always refer back to the webinar. It'll be posted on the website. We've got last week's webinar already up, and it's very helpfully time-coded, so time-stamped, so that you can jump to particular sections if you need to learn about one subject in particular. So that's very helpful. You can also refer to the very detailed FAQs that we have on the internet, and those continue growing. I think I should have an updated FAQ posted, if not today, then tomorrow. Again, that document continues evolving as we get more guidance from the federal government about how to best implement these laws. So I just ask you to bear with us as we, try to navigate this very new process. If you have any questions after today, first of all, you can obviously reach me personally, but you can ask any questions related to COVID leave. So EPSL questions, EFML questions, timekeeping questions, whatever it is, you can email covidleave@metro.net. We've also established a dedicated phone line just for these kind of questions. You can reach staff there at 213-922-4840. And you can leave a message with your contact information and we will call you back. We've been very successful with getting back in touch with people who've had questions. We don't want you sitting out there not knowing what to do. So my team has been very responsive and trying to get questions answered same day if possible, but in any case, no more than 24 hours after the question is asked. So I would encourage you to utilize those resources.
Thank you for such a clear and comprehensive presentation.
You're very welcome.
I think another question just popped in.
Yeah.
So.
That's okay. We can take it.
I'll reinforce the gratitude for the great job done by not just members of my team, but our partnership with payroll, and for everyone's attention to this. I want to go back and remind people of the overall focus here. It's important that we really work to get these complex regulations implemented in a very demanding time frame that are correct, that we're accurate in what we tell people, that we're consistent, meaning fair and equitable to folks, that we hold the confidences of our employees and our coworkers as they share that. It's so important. And the compassion that we need to have for each other as human beings and as people who are struggling and trying to figure out their way through a situation that I think none of us could have ever anticipated. So if you get lost in the regulations, I think as long as you're consistent and correct and compassionate and hold it confidential, you'll be successful. We'll be there to back you up through that. Thank you again for your time and attention. Really, really appreciate it. I'm going to sign off.
Bye. Thank you.